and welcome once more to our show, Did You Know? Back to the Basics by Dr. Magde. Today I'm going to talk about something that we have all experienced, headache. Sometimes when you get a headache, you want to run for a painkiller. But I'm saying to you, wait, because a headache is a trigger from the body indicating that something in the body is not right. Is that something flickering, saying something is not right in your body? Investigate. Don't just take a pain tablets. So we do have different types of headaches. We call them cluster headache, which can happen on the front, but we also had frontal headache, which can happen on your sinus area, which got headache, which can be gripping you around the neck, especially due to stress. So, as I said, a headache is a trigger from the body indicating that something is not right. So, I'm going to group them so that you can easily identify it. So, we've got headache which are physiological. Physiological means that something is wrong inside your body, something is happening inside your body that might be causing you to have this headache. The most commonest thing that happens is infection. When you have an infection in your body from whatever source, it can cause you to have a headache. But the other cause is low blood sugar. If you are really hungry, that can trigger a headache. Or if your blood sugar is very high, that can also trigger a headache. So also your blood pressure, when it's high, it can trigger a headache. But also low blood pressure can trigger a headache. But we know that also other headaches are called a certain infection like sinusitis. When you have sinusitis or blocked nose, you get that frontal type of headache. And some serious diseases like meningitis. But also in women, we have various causes of headache. The other one that is common is hormonal. It's because their hormones are reacting. It's that time of the month. It's premenstrual headache. Note if you get that type of headache. But the other causes that people don't know it can cause you headache is dehydration. If your body, you haven't been drinking enough water, your body can trigger a headache. And the other things can be vision problems. Vision problem meaning you've got challenges with your eyes and you don't know. If you think so, you better go and consult. But other causes are not about something being wrong in your body, but they are sometimes due to what I call emotional or psychological issues. When you are thinking too much about something and you can't sleep, it can cause a headache. So it could be tense muscle due to anxiety. They cause headache. Your shoulder and your neck muscle, they are tense because you are worried about something. And also lack of sleep. If you don't sleep enough, you can get a headache. And undue worry can cause you a headache. You are worried about this issue, you are overthinking it, it can cause you a headache. So the headache is caused by muscle tension, and because your body is anxious, there is a high release of a substance that we call adrenaline that also makes your heart to pump. You are anxious, your muscle are tense, you've got headache, you can't sleep. But the other things that can happen to cause a headache, and it can be an injury. Any injuries to your face, injuries to your head, internal injuries to your brain, those can cause headache. So if somebody even had a laceration on the head, it will cause a headache. But sometimes, mostly as women, they braid their hair, and then they get this tightness of the muscle, and then the body reacts, and you've got these nodes coming, which we call lymph nodes. Those are the body indicating that something is not right. They have tightened you too much. That thing can also give you headache because they braided you and your braid are very tight. If your braids are very tight, they can also cause you to lose your hair. But as I said, they give you a headache too. But the other things that people don't aware can give them headache is food or drinks. You know, some people react to certain food, and the most commonest one, people get migraine because they've been eating a lot of sweets, they've been eating chocolate, they've been eating dairy. There are lots and lots of people who are sensitive to dairy. So when they drink dairy or if they eat chocolate, they are going to get migraine. So what I'm saying is too much sugar can cause you to have headache, can cause you to have a migraine. But the other thing also is alcoholic drink. Alcoholic drinks, the mechanisms, there are various mechanisms why you get a headache. But the other one is that one of thirst, because the alcohol makes your blood or your kidney to be sensitive and you lose a lot of fluid. So post alcoholic binge, one usually have a headache. The other things that can cause a headache is caffeine. People are drinking too much colas, people are drinking too much energy drinks. Those things, they keep you awake. Coffee, because they've got caffeine, they make your body to be alert. But at the same time, they can cause you headache, they can cause you also palpitation. I've talked about caffeine drinks, and it include those energy drinks, it include coffee, it include tea, it include colas. They can cause you to have headache. But the other thing that can cause you headache are dyes. What they put in the food to dye the food to give them a yellow color, a green color. Those are colorant, and those colorant, they are not natural substances. So therefore your body can react with those colors and give you headache. But the other thing that can give you headache are preservatives. What are preservatives? Preservatives are things that they put in food to make sure the food does not rot quickly. So they lengthen the shelf life of food. There are many preservatives that they use, the food manufacturers, but those preservatives, they can cause you to have a headache. So take note. But the other causes, things that are also common that can cause you headache, are medication, especially medication that have codeine or ephedrine. Codeine and ephedrine, there are certain substance that they put in the thing that can cause you to have a headache. But not only that, any medication can cause you to have headache depending how your body reacts on that medication. But the other thing that can also cause you headache are medicine withdrawal effect. What do I mean? Let's say you've been on a course of this treatment, but then suddenly you stop. Sometimes people get headache because of that. So, as I said, don't just run for a painkiller when you are having a headache. Try and see, or try to find out, why am I having this headache? So I'm just quickly now going to wrap it up, and just to make it interesting, I've just grouped them also according headaches that are common in females. I've already said the hormonal, premenstrual, food and drinks, dehydration, low or high BP, low or high blood glucose. But the most common one, as I said, in females is hormonal and migraine. Okay, so the headaches that are common in men: alcohol, dehydration, alcohol withdrawal symptom, that can cause a headache, and medication, and also high BP. It's very common in men because men normally don't want to consult. They will wait until something has festered. So how do you deal with this headache? As I said, don't run for a painkiller. Ask yourself, why am I having a headache? Drink water, try to relax. A persistent headache that you cannot link with something then that you can go and consult, because it's not normal for you to be always having a headache. If a headache persists, just try and find out, why are you having this headache? It could be one of these things, because of injuries, a tumor, an infection, or the BP being low, the BP being high, the sugar being low, the sugar being high, or just your reaction to normal food that we eat every day. So I just want to thank you so much for listening to our broadcast once more on headache. And I like to say, please don't forget to like, share, and subscribe. Dr. Magde. See you next time. Bye.